YouTube. Well, we are here at 31 weeks. I don't know how we got here so fast. I'm sure a while back I was saying that it's going really, really slow, but all of a sudden it is just rushing by. I feel like I haven't had a chance to get anything done that's supposed to be done by 31 weeks. Well, a lot has gone on. I did forget to mention a couple things in my 30 week, and my cat is in here. This is Chris. He's in here, and he's probably gonna go all over the place. You'll probably see him walking around. But anyway, so I did forget to mention that for my last OB appointment, I did get the Tdap injection in my arm. I've never gotten that in pregnancy. I have been asked if I wanted it, and I've always said no. But this, for some reason, I feel like I really should get it. I was kind of scared with Amelia because she was born in November, that I ended up not getting it when I was pregnant with her. So since I was a little bit, I was a little upset that I didn't get it the last time, and it caused me so much worry. I decided to go ahead and get it this time. So I did. I got the Tdap. I got it in this arm, and it hurt. My arm hurt for like 2 or 3 days. I had a lot of trouble sleeping on this side after I got it done. And then after about, I want to say about 2 or 3 days, it didn't bother me anymore. So I did hear that if you've never gotten the Tdap before, that for some reason it causes more soreness than if your body has already had it, and what's the word I'm looking for, like recognizes the vaccine or something. I'm not really sure what that's all about, but that's what I have been told. So anyway, yeah, so I got that done last time, and then I forgot to show you guys something that I got for my hospital bag. I am going to be packing my hospital bag. It's going to be done by 32 weeks because I had my first daughter. I know I say this all the time, but it's a really big factor right now, especially since we're at 31 weeks now. I had my first daughter at 36 and 4 days, my second daughter at 35 and 4 days, and just because I am paranoid that my son is going to come at 34 weeks and 4 days, I want to have everything as much as possible done just in case he does come between now and my due date. I feel like I have more of a chance of him coming early just because it just seems like my body gets to a certain point and then it's like, okay, I'm done, and just I go into labor. So yeah, I got a bag from Etsy. Let me show it to you really quick. Actually, it is the chevron. I don't know what it is about this style, but I really like it. Anyway, I got it from Etsy, and I got my initials on it, and it has 2 pockets on the outside, and they're pretty deep pockets. It's on both sides, and then it has the zipper here on top. It's the 2 zippers, so it goes either way, and then it has like a little zipper here in the front, and then when you open it, it's just one big bag, so that you don't have to fill pockets with stuff that you know you probably don't need, but you have these pockets. So it has the straps like this that you can Velcro together and carry it like this, which I most likely will. Thought I saw another zipper. I was like, oh wow, another pocket. And then it has this thing that I haven't put on that goes on either side, and you can carry it with your shoulder. So I'm really excited about this bag because the bag that I took for Amelia it was too small. It didn't fit things like my hair dryer and stuff in it. And I didn't notice that until I was leaving the hospital, because I didn't bring a bag to the hospital. I was expecting them to stop labor at 35 weeks. I just expected it, I don't know. And so when I got to the hospital, when they checked me and I was a 6, they were like, "Oh no, girl, you're staying here. You're having this baby. You're here." So my husband had to bring all the stuff to me, and of course I can't remember everything to tell him. I just had a baby, and he doesn't know what to get me, so it came in small increments. I was there for 4 days, so he brought a lot of stuff to me, and I couldn't fit anything back in it. I couldn't fit like my hair dryer or my brush and stuff like that. I had like clothes and things for the baby, and my husband brought me size 2 jeans to wear home. It was really an ego knocker. I got him up to, I think, right before I hit my thighs, and I started crying, and I was like in the bathroom, and I said, "Honey, you bought me a size 2 jeans. I can't get in a size 2 jeans." I had just had a baby. But he didn't know. It's funny to think about now, but then it was just, some women walk out and they are a size 2 again. So, not me. Anyway, so I'm really excited about that bag. It's a lot deeper, and I can fit a lot more stuff in it. And I'm contemplating putting this baby stuff in there with my bag instead of taking 2 bags, because I know I'm not going to need like diapers and wipes and things like that. Maybe I'll put 1 or 2 in there just in case on the way home. But anyway, so there's that. I am going to have to get up and open the door my cat wants in. My other cat, Leroy. And that was another thing I forgot to tell you guys. The adventure of Leroy. Come in. Come on. So, I have this cat. We got him last year. He's my daughter's cat. His name is Leroy. And she named him. He likes to eat things that are non-food. He eats my dry flowers. If I have any artwork laying around, he'll eat like little pieces off the frames. And you just really have to watch him. So I go to scoop his box, and there's ribbon in his litter box that had come out the other end. Anyway, long story short, he ended up in the vet clinic for a few days. And that was another thing I forgot to tell you guys last week. I was so tired. So, okay, so he's much better. You can tell. He's all frisky again. And back to trying to eat things that you're not supposed to eat. So, okay, there's that. My indigestion is back. I'm going to go on with symptoms. It just comes back and it goes away. I think it's gone. I'm so naive that it comes right back. Like I said before in my other videos, sugar is a big factor. Every time I eat sugar, it comes back. Cravings, I have to have something sweet, but it doesn't matter really what it is. If I have just a little bit of ice cream or a little bit of chocolate or whatever, it pretty much satisfies my craving. So I'm trying to just eat a little bit at a time, and I'm trying really, really hard to sit up straight so I'm not smushing everything together and it doesn't push like the acid up. I'm sorry, that sounds disgusting, but that's pretty much what it does. Let's see, update on my daughters. The other night, about 2 nights ago, I decided that my second daughter, Amelia, she's, I guess, my middle child now. It's so hard to differentiate, but I guess I can call her my middle child now. I have to put her to sleep by laying beside her or rubbing her back and like sitting beside her. I have to be there with her while she goes to sleep. The other night I decided that, you know, I wasn't going to be able to do that. My husband's parents, who are coming to help me out, they kind of have a different philosophy with kids, and I know they do. I've seen it, and when they talk about, you know, watching their grandkids, or if I see them watching their grandkids, I see it. It's different. And I know that they're not gonna, you know, probably not, I haven't asked them, maybe they would, lay there with Amelia while she slept. I doubt it. So, I decided to kind of take out the trauma. It wouldn't traumatize her, but just kind of, you know, get her used to what is to come with their grandparents putting them to bed, that I was going to get her to lay down and go to sleep. And I did the whole, I don't do this with babies at all, because I don't believe that babies are mature enough for this. I wait until they're about 2 years old, which she is. She'll be 2 in a couple months. And I let her kind of cry. And she did. She went to the door and she cried and wanted me to come. And I set a clock for 2 minutes at first. And the second time it was 3 minutes. And the third time it was 4 minutes. And finally, I didn't hear anything. And I thought, oh, wow, you know, this was quick. And like 15 seconds later, my oldest daughter, Mia, was like, Amelia's in my bed. She had climbed up the ladder and gotten into her sister's bed. So my older daughter actually was like, I'll go sleep with her in the bed down there. And she did, and Amelia went straight to sleep. Last night she cried for, it was under a minute. My oldest daughter, sang her a song and she went right to sleep. Same thing today. It wasn't even a minute. It was like maybe 10 seconds when I was putting her to sleep. So I have kind of been up and listening. I don't want to put a burden on my older daughter because she's 4 years old and she's not the parent, and it's not her job, it's mine. So if my daughter were to wake up at any point, I wanted to be right in there to, you know, make sure that I was the one that was sleep training her, and I was the one that was responsible, not my oldest daughter. So, and that's a big deal to me, because I don't think that that's a kid's job. So, anyway, so that's going really well. My oldest daughter, I mean, basically all she has to do is just sing a little bit to her and she goes to sleep. They both go to sleep. She sings herself to sleep. So I'm really happy about that. That is the main reason why I did not put the deployment video on, because I have been kind of consumed with that, and I feel comfortable making this video today. And I think that I might start working on the deployment video tonight, so I can have it on this weekend. I'm so sorry, guys. Anyway, so that is pretty much what is going on this pregnancy. I will update you about Dave, my husband, in the deployment video, let you guys know what's going on with him. And I guess that's it. I will show you my belly. Let me move some things around, because I actually have some stuff stacked up so that the camera is at the right angle. I'm not good at this. Anyway. Okay. Here's the belly at 31 weeks. I've dropped, can feel it. There's no baby up here, just down here. So, front, side, looks smaller once you drop. Belly. There we go. Alright guys, well, I will be doing that deployment video. I'm going to work on it tonight because I have plenty of time. And I will probably be getting that on this weekend. I promise this time. Alright guys, have a nice day, night, whenever you're watching this. Thanks for watching. Bye.